From a public health standpoint, one of the big challenges is identifying what are the populations that need assistance and support when it comes to improving health and well-being. One of the things that's fascinating about the idea of men's health is despite the fact that men are advantaged in so many economic, social, and political aspects of our society, their health actually tends to be worse than that of women. Despite men in Tennessee having a 5-year shorter life expectancy than women, men's health in the state tends not to get the attention it deserves. This is not a unique thing to Tennessee, but this is something that we face across the United States and generally across the globe, that despite the fact that men's health tends to be worse than that of women, it doesn't get the attention that the health profile would suggest that it should. Tennessee is unique in that this is the 5th time that we've regularly done this report card, and we're one of the few states in the country, as well as one of the few municipalities in the world, that has actually consistently provided such data to guide policy and practice as it relates to men's health. The report card is not something that we at the Center for Research on Men's Health do in isolation. We partner very actively and closely with the Tennessee Department of Health, Meharry Medical College, the Tennessee Men's Health Network, Vanderbilt University Medical Center, faculty from Belmont University and University of Memphis. This is the first time in the 5 iterations of the report card that we've done that we've been able to substantively include comparisons of Hispanic men across the state. We were able to include information about opioid overdoses as well as traumatic brain injury. The report card is meant to stimulate conversations, efforts, policies, and practices to improve men's health, not just to sit on a shelf. Some of the good news that we've seen in Tennessee over the last 5 to 10 years is that, in particular, the cancer rates have actually been going down rather significantly. The goal of men's health is to recognize that men are parts of our families, communities, and state in ways that we have to consider their health and well-being in addition to that of other members of our communities and families.